Hi everyone, my name is Nika Tavberidze. I am a sixth year medical student at USMD. So today we're going to be talking to Nika Tavberidze and Dr. Gvantsa Metskhvarishvili. Nika is a sixth year medical student as well. This is part of a conference that a virtual live streams called More Than Medicine. And the reason why we came up with this is because a lot of you are doing your clerkships at home online, and these are clerkships where you kind of figure out what kind of medicine you want to practice, where you want to practice, what kind of a doctor you want to be. And as medical school wraps up for me, I've been doing a little bit of thinking of the same. And I decided, why not call my peers and my teachers and my doctors who I worked with for the last 6 years to kind of share a bit of insight about what their journey in medicine has been like. So without further ado, I would like to invite Nika, and he is going to join us shortly. Nika!
Hey, how
Hi,
are you?
can you see me?
Actually, I can. Oh, yeah, I can see you now.
Awesome. Nika Tavberidze is one of my old friends. The first day I met him, he was drawing big molecules on biochemistry for metabolism. He is an artist. He loves anime. He loves German. We both love Murakami. And there's just so much we can talk about. But today we're going to talk about something Nika is really passionate about, which I haven't seen. I've not heard anyone else talk about pathology the way he does. So, Nika, take it away.
Well, yeah, I love pathology. That's the field I want to proceed my career in, and this is something that really motivates me daily basis, doing medicine, actually doing a lot of things in my life. I think what I really want to do in future, and the first thing that pops to my mind is pathology. That's nothing
Yeah, I remember
else.
in third year we did pathology together, and I remember you straight off the bat being fascinated by it. And we were talking before, and you actually draw a lot. You draw, you paint, you sketch, you do a lot of things. And tell me how that kind of inspired you in pathology.
Well, at first I really didn't knew what the pathology as a field really meant. And then I discovered that, you know what, pathology is quite a visual field. There is a lot of things that is necessary. I mean, there are a lot of skills that you need to master before you really want to do pathology. Mainly what I mean is like to recognize the shapes, the figures, and then draw the conclusions out of those. So when I discovered that, you know what, my skills in drawing and painting is really handy in this profession, and I was like, maybe there is something else in pathology. And then I started learning all the, let's say, types of leukemias, all the types of other cancers, and I was like, oh yeah, like it is totally an art form, and I
I
really
remember you
like.
talking about how you like looking at blood on the slides.
Totally. That's my favorite. Blood and the bone marrows are two my favorite tissues to look under the microscope. And I was really fortunate to do that a lot at Emory. Usually like 5 days out of, let's say, 7, I was sitting at my desk with my microscope and looking at the bone marrow. And that was everything I wanted to do.
That sounds like my eighth grade dream come true, because I was constantly obsessed with looking at things under the microscope. And so, like you mentioned about your clerkships at Emory, you are one of the few people who got the opportunity, I mean, chose to do two clerkships. You did one in pathology and laboratory medicine, and you did one in oncology, oncohematology,
Yes.
right? So, could
Yes,
you
that's
tell us what your experience there was like?
Well, my experience in pathology, like going first, I was really not prepared what to expect because like we learned pathology quite as a subject, not as a field of medicine. And I was quite worried because maybe I was not good enough for real medical pathology. Maybe I knew things that I should have learned or something like that. But fortunately, everyone was so helpful. I've got a good residents who were guiding me, who were giving me all the literature I needed to read before going to the lab, and it was an experience. It was not as easy as I thought, but it was a really really great experience there. And about oncology, another great field of medicine. I was really, really fascinated how professional the doctors were, how they were handling all this emotional and physical stress at the same time, and I was really inspired by them as well.
So we did something called forensic pathology recently, and
Yeah.
before we did forensic pathology, we obviously have been exposed to CSI drama and things like that, and it
Hmm.
turns out your field is quite linked to forensic pathology. So could you
Yeah.
tell me how you came across, what part of forensic pathology that you have come across?
Well, as you mentioned, there are a lot of topics that overlap between the clinical and anatomic pathology with the forensic one. And during my rotation, we had the lectures in forensic pathology as well, mainly because of a lot of similarities and a lot of things that were common in both of those fields. And usually at Wednesdays, I believe it was, we were having toxicology lectures in the mornings, and there were such a great cases, like it was real criminal cases. And I
Like
remember like
homicide.
sitting there and like imagining myself in the middle of this CSI movie or something like that, because these cases were so I don't know, like really, really cool cases. Like,
Do you remember any that come into mind?
I remember there was one case where there was suspicion for homicide with the intoxication, but they couldn't figure out the drug. They screened nearly all the illegal and even legal substances, but they could not find a high concentration of drug. And I believe in the conclusion, what they did was, I think. There was one drug that was causing decreased clearance of the other one, and that's how it caused the toxic effect on this person. And that's how they drew the conclusion that it was not a homicide, rather it was a accident.
Oh, okay. So I'm going to ask you a question. And we've spent we were in the same group for a couple of years. So we've had a lot of PBLs, and in
Oh,
group one, PBLs can get really heated.
that's so true. That's so true. Yeah.
So you want to share with us any memorable moments you've had through medical school?
Oh, actually, yeah. Like one of my favorite memories from the medical school, especially it's actually about the PBL. I remember it was probably the third year or the probably it was the third
Third
year
or fourth
because
year, yeah.
we were not good at pathology and diagnostic yet.
Yes.
So I remember there was a case that Dr. Gvantsa brought. There was about the ascites in the abdomen and like all the symptoms and all the
Ovarian
laboratory
cancer.
diagnostics we are about the ovarian cancer. And I knew that it was an ovarian cancer because I was like, yeah, that's obvious, an ovarian cancer.
Yeah.
But like during PBLs, you list all the diagnoses that
All
could
the
be
diagnosis.
possible, right? So I come up with the idea that, you know what, I know that pericardial mesothelioma and pleural mesothelioma can cause fluid in the sac. So why not peritoneal mesothelioma is a thing? So I was like, yeah, that could be a peritoneal mesothelioma. And I remember all of you just like laughing at me because it was such a like not possible, like it was not a possibility. And I got so mad about that I was like, no, it's peritoneal mesothelioma. And in my mind, I'm like, oh, what I'm getting myself into. And I remember that after the lecture, it actually was a peritoneal mesothelioma, which was totally by
Danielle is here. She
accident.
remembers this. She just
Oh
commented
yeah,
saying,
and I
"Oh my
remember.
God, I still can't get over this diagnosis. I dream about it."
That's so true. Because Daniel was the first one who said that it probably was an ovarian cancer, and her main
Yeah.
diagnosis was the
Sorry,
ovarian.
yes, yes, I remember this.
Oh yeah. That's one of my
This
favorite
actually
things.
reminds me of the time we both ended up on a BAD case together, and we had to diagnose a patient in Dr. Gvantsa's clinic. And we ended up saying he might have Waterhouse Fredrickson.
Okay, let's say it true. That was me who said that, and it was such a ridiculous diagnosis because this patient was having CML, and I
Yeah,
was like,
his
oh
leukocytes
no.
were like 10,000 or something. And we're like, oh, maybe he has like adrenal insufficiency.
Yeah, there was no, I take the responsibility of that diagnosis on myself.
Yeah, we've come a long
You
way
diagnosed
since
him
then.
correctly. Yeah.
Yeah, we've come a very long way since then.
Oh yes, very
So
very long.
before I speak to Gvantsa and share with her your mesothelioma story again, can you tell us what you think, in your opinion, is a few qualities that make a good doctor, or just to kind of, or what qualities you need to kind of persevere through medical school?
I see. Well, from my experience, what I saw and what I really appreciate doctor to have is that the doctor should have a really good empathy. And I know that is something that a lot of students struggle, including myself. I had a really hard time to show my empathy to the patients, even though I think I'm quite an emotional and empathetic person. I think that's one of the most important qualities. The other one is a desire to learn more and to develop yourself on daily basis and to be ready to learn all the new stuff and not to be afraid to be wrong. Because I have seen a lot of people just trying their best to be always right, and that's not gonna work. Like everyone makes mistakes, and it's okay to make mistake, and there's nothing wrong with that. And the last thing I would say is that doctor should have a personality. Like we should all have our unique perspectives, our unique ways to talk and to be interesting. Like you don't go to a doctor just to be treated because like we are like they are humans too, and like you need to communicate with someone on the personal level as well. And I think some doctors are really lacking personality, and I think that that is really important to show who you really are so that people can trust you. I would say those three qualities would be the great one.
That is amazing. I have nothing to add to that, because personally I think you have a great personality, because you spend a lot of time in extracurriculars as well. Like you make
Maybe way
time.
too much.
No,
maybe
I think it's like a fine line, because not all of us are good at balancing both, especially when medical school doesn't obviously give you the freedom or time to explore. So could you tell us what you like doing in your free time?
oh my A lot of things actually. Mostly like when I have a lot of time, spare time, I usually want to chill and have a good rest.
Yeah.
I'm not quite a hyper person, so I usually go and paint, draw. I love reading, as you said, like our favorite writer is the Murakami. I like to read and reread all the Murakami books. I'm obsessed with him. But like sometimes when I'm feeling really, really good, I might go out and have some fun
Yeah.
and a couple of
Yes.
drinks.
Stay
Why not?
stressed.
Yeah.
And anything in moderation.
Oh yes.
Yeah.
Totally.
Thank you so much, Nika. I really appreciate that you came in here and tried to share a little bit of insight about your story and just why you were in medical school. And so you're done, right? Like with the year?
Yep, actually I'm done.
Oh my God,
I I'm
congratulations.
so happy. Thank you so much.
Nika
Thank
Tavberidze,
you.
MD, soon.
Oh yes.
Yeah, good luck with residency, good luck with pathology, and we will be hoping to hear from you as a pathologist.
Oh, thank you so much. And
Yeah.
I will make sure that I won't disappoint you.
Bye.
Bye bye.
So that was Nika, and thank you so much to everybody who joined us, 27 of you. I hope this was somehow insightful if you ever wanted to become a pathologist. And I liked a really nice thing I liked from what Nika said was that not everyone is great at expressing empathy, even though they might be able to feel it. And so I think choosing a field that's right for you, choosing a field which kind of complements your strengths and weaknesses is really important. So the second person we're going to have today is one of my BAD instructors, my teacher, and a very good mentor of mine personally, Dr. Gvantsa Metskhvarishvili. Hello.
Hello, Nika.
Hi, how are you?
Thanks, fine. How are you?
I am doing well. So Dr. Gvantsa is a nephrologist at high technology medical center. She has done her fellowship in the UK. She's done her residency in Turkey. She is involved in renal transplantation. She is a BAD instructor at USMD and a very big inspiration for me personally. So
Thank
take
you
it
so
away.
much. So you listed a lot of stuff, but I would just say I'm a doctor and I'm a teacher. That's all.
Yeah. So
And
for people who
yes.
don't know you, Dr. Gvantsa, could you tell us what you do, where you work, and what an average day in your life is like?
Okay, so I'm a nephrologist, and as you said, I'm a BAD teacher as well. So most of my day I spend at the clinic, and I deal with inpatient and outpatient patients, and transplant patients, and dialysis patients as well. But this is kind of a list what I'm doing, but I can tell you that nephrology is more about having, well, it's for me at least, it's like to be in the most interesting field in internal medicine. It's a field where you will never get bored. The most complicated one in the internal medicine, and I don't know, this is the thing which um, can make your eyes shine all the time. You see interesting cases, and you see interesting cases a lot. So I don't know. It's hard for me to describe. I don't know
Could
what I
you
do
tell us
because this is
could you tell us
like
some of the
everything for me, I
pathologies?
guess. Sorry?
Could you tell us some of the pathologies you deal with, like what kind of patients you see a lot?
Oh yes. So well, as you know, nephrology it's a kidney, but it's never just kidney alone. That's why I like nephrology. It's like whole internal medicine. So you deal with glomerulonephritis and dialysis and transplantation, but in most cases you find out that patient you're dealing with, and definitely he or she has got a kidney pathology. Usually they have like 4 or 5 comorbidities, and the patient comes with kidney pathology, and then you find out and you make a diagnosis of oncohematology or like rheumatological disease or something. So it's just never a kidney alone. And I think this is what makes nephrology so exciting, because it's so complicated. And it's also, I'm not going to use formal words and speak more academically today. I'm going to tell you it's real fun to make diagnoses and have
I know
all
this
the
because
cases.
I've been I've done clerkships at your clinic, and it is literally like a scene from Doctor House. Where everyone is sitting at the table and like giving diagnosis and coming up with like counter diagnosis, and then okay, do you want to order this test, but why do you want to do it? You question everything.
Absolutely. Yeah. So
Yeah.
even like the process of making a diagnosis and finding what's going on is absolutely fun, and it's absolutely something I enjoy a lot. So
So
I
you
don't know.
something really unique about you that I found out quite recently is that you did your residency in Turkey. So you were a student who had to study in a country where you didn't speak the language, just like me.
I did. I
Yeah.
did.
So
Yes.
you when you went to Turkey for your first year after a medical school, you didn't speak a word of their language,
No,
and you couldn't
I just spoke
communicate.
English.
Yeah, you couldn't communicate with your patients or like your peers. So how did you get over that? How did you work around that? And could you share us
Um,
your experience just in
yeah. Well, I can't say it was easy because it was quite challenging because it was my first time living alone from my family, and being like independent and being independent in a country you don't speak like their language and you just speak English. Well, I was lucky to have English speaking doctors at the university hospital. I worked there and I studied there. Uh, so they really helped a lot and they translated almost everything and they tried to do everything in English. But I think the main thing what helped was like motivation to become a good doctor, and this is what I needed to do, just to study a little bit their language and just to try my best to deal with the patients and just to gain as much as possible I could from there. So I think this motivation was what helped me, although it was like very stressful. I even gained 10 kgs because in 1 month because of like having a lot of stress, being in a country you don't speak language and it's foreign country and you're still young. So it was a huge stress, but at the end of the day, it was a very good experience and I gained a lot. And it's not just knowledge I gained from there. It's much, much more, and it's a huge experience. And I'm very lucky I was able to get there. So I was like, when I was talking to my students who had to study here and like you was, well, you are from another country and probably you didn't speak a word when you came here. I was like, I absolutely understand it. I can feel like in your in your shoes because I understand what you have to go through being a foreign student and not be able to speak a language and you wanna gain as much as possible, but patient speaks different language. So I absolutely understand what you all have to go through when you're in another country and not speak the language. So yeah,
So
it
while
was a
we
nice
were,
experience
so
and
while we were
challenging.
speaking,
Sorry?
while we were speaking, we had a comment, a question rather. If it was not nephrology, what field of medicine would you be most interested in?
Um,
And the
anything
question
like
comes from
about,
a student,
yes.
a fourth year student in USMD. His name is Alif, and he wanted to ask you.
Oh, thank you for the question. Well, I think I would feel comfortable in any field which would be so complicated, which would make me think a lot, and it wouldn't be easy. So I maybe it will be like internal medicine, like the whole one, like hospitalist, or maybe rheumatology. Because when I was thinking about what would be the field I would go to residency, I was thinking about rheumatology and nephrology because both are very complicated. But I ended up in nephrology where I do have a lot of rheumatology and the whole internal
Yeah.
medicine. So I feel like we're lucky because I think I have made a correct decision because I have it all here: nephrology, internal medicine, rheumatology, everything is in nephrology. So um, I wouldn't change it. So even if it was a day I had to choose again and I could go back, no, I wouldn't change it to anything.
Yeah.
No.
Nini Dwali asked us the question. She asked,
Yes.
"Are you fluent in Turkish now?" And I can answer this question because the reason I know this story, the reason I know you studied in Turkey is because we were with a Turkish patient, and that I was struggling to kind of talk to a Georgian patient. So when it came
Yes.
to that, I didn't know what to do. So I asked you, and you spoke to him fluently and figured out what he was
Yeah.
trying to communicate.
So, no, actually, you couldn't understand mistakes I was making because you don't speak
Of
Turkish.
course.
Actually, my Turkish is awful, but the main thing is to communicate with the patient. So, what I found out while being in Turkey was like patients don't care about your grammar mistakes. They don't care if you pronounce the words properly. They just care that you can communicate with them and that you are trying your best and you're speaking their own language. So you're communicating with them with like using their language, not yours, and not any other foreign language. So the main thing is like they are saying you're trying your best and you're communicating. So nobody cares about grammar, nobody cares about mistakes. So it's like doctor and patient communication. That's all that matters.
That's true.
And it doesn't matter which country you are.
And I think this is really important because becoming a doctor is what you teach, and a lot about becoming a doctor is bedside manner and
Yes.
just being able to connect with a patient on some level. Like we will definitely come across people we don't speak the same language, and doesn't mean we still have to figure out why they're there and things like that. And one interesting thing that you've always said that I remember is always knock and just ask.
Yes.
Just go knock on the door and ask. And
yes.
So you're also very open about, you advocate about burnout, and you're very open about, you know, the ups and downs about just being a doctor, being a medical student. So could you tell us a little bit about that?
Absolutely. So I wanted to talk about this topic because I think this topic is kind of not spoken enough about. And I feel that we have to talk about this, being a medical student or being a doctor, you know. If you're a doctor, it doesn't really matter you work in Europe, in the US, or in Georgia, or you study there. So being a medical student and being a doctor means being at risk of burnout a lot. And sometimes medical students or even doctors are ashamed of having burnouts or even just to talk about it. And I think that's an issue because there is nothing to be ashamed of, because burnouts do happen. And they do happen while being a medical student, while being a resident, or being a doctor. Well, personally, I have had burnout episodes at least 2 times while being a resident and then being a doctor later. Well, probably you haven't noticed me having a burnout, but I did have burnout episodes. And the thing is, like, you have to speak up about it, and you have to realize your well-being matters. So well-being of doctors, well-being of medical students, this matters, and it is important, and you have to speak up, and you haven't to be ashamed of. So having a burnout doesn't mean like you're a loser or you can't like overcome. Well, I'm telling you, I have had like 2 episodes of burnouts, and I'm lucky I was able to overcome my burnouts. And today I'm like feeling again lucky to be a doctor, lucky to be a teacher, and I feel like we're happy right now. But I did have burnouts, and that is fine to talk about it. And I think it's so important for medical students to know that these things do happen, burnouts do happen, and it's not the end of the world. So the thing is, like, they have to talk about to their attendees, to their friends or advisors, and there is nothing which can't be fixed. So
I think it's really courageous of you, because personally, not just me, everyone in our year knows you're one of the best instructors, that you're one of the most hardworking people, and for you to come out and talk about this issue is incredible. And thank you so much for sharing with us.
You're welcome.
Yeah, I hope we get to speak more about nephrology. And so I wanted to ask about your fellowship in UK. So you did a fellowship in renal transplantation, right?
Yes, I did. Yeah. So one of the fields of nephrology is, of course, kidney transplant, and this is one of the things what makes nephrology exciting for me. Well, I'll just talk briefly about kidney transplant. Yeah, actually, a fellowship about kidney transplant in Glasgow. So I had my fellowship in transplantation, and then I concentrated on disease kidney transplantation. and which was very exciting for me because, as you know, there is not PC kidney transplantation in Georgia yet, which is in progress, and it's kind of work in progress, and hopefully we will have it soon. But so far, it's just living kidney donation. So it was a very great experience for me. To be able to spend 3 months in kidney transplantation and get experience about it. But the most exciting thing now, kidney transplantation, is like transplant immunology. So who loves immunology? I think they will agree that this is one of the exciting fields in medicine, and absolutely like fan of transplant immunology. And this is one of the most interesting parts of transplant and my job so far. So this is just briefly about my fellowship in
So,
UK.
for second, third, fourth years who are listening, the thing we kind of most struggle with is to quote Danielle, because she asked us question: what are these pink things that we see on nephrology, and how do you differentiate them? Because it's so hard.
What I mean, the
Like,
pink things.
like histopathology.
Oh, the pink things. I'm not sure what you mean, but probably you're meaning the cells, like, or the tubules. So probably you ask about messenger acids. So I'm not sure. So I have to see the
Any
picture.
kind of pathology that involves looking at slides
Yeah,
is very difficult as a third
yeah.
year. And
But
does it get easier? Like, how does it get easier? Just can you
oh,
talk
so
about that?
now I get the question. So I would answer. So even for me, being a third year student, I think it was the toughest year for me because, yeah, that was pathology and like many tough subjects I had to go through. And while being a student, I did not really like pathology, frankly, while being a third year student. But I think because I didn't really realize why I needed pathology for, I mean, what was the need of pathology, why I had to like know all these cells and what's under microscope. So I didn't really realize what was going on there. But now being a nephrologist, you know, also pathology is one of my favorite fields in medicine. So my point is you have to know why you are studying. So you need motivation to know why you need to know the pathology of the disease. So, and I remember when being a residency, actually that was in Turkey, and we used to have the rounds, and the professors used to ask all the questions during the rounds, and that was really exciting. So one of the professors used to have very tough questions, and they included like pathophysiology and anatomy, like the basic stuff and very deep stuff, which sometimes we had like forgotten. And I remember him telling me, so Gvantsa, if you know pathology and pathophysiology well, you will be a very, very good doctor. But if you just study symptoms and clinic and just like general stuff, you will be like an average doctor. And I will never ever forget these words. So you have to know the disease from like very deep, from pathology, from pathophysiology, and then you know what you're treating, and then you know what's really going on. So now, well, if being a third year student, I knew why I had to study pathology, maybe I would do better. I don't know, and I would know why I'm studying this. So, well, from this perspective, I want to recommend, yes, you have to know pathophysiology and pathology well. And also, you don't have to think that, oh, I have studied this and I will never forget this and it's enough. So when you become a doctor, you just have to go through and study pathology and pathophysiology over and over again, and just everything starting from ABC. And it's not a shame, and you can't be a good doctor if you don't review even from pathophysiology and all over again. And that's a normal stuff for a doctor. And I absolutely agree with Nick. Well, he was talking about growing as a doctor, and to have like to realize you can have mistakes, and it's okay to have mistakes, and it's okay to say I don't know, I have to read about it, and it's okay to realize oh no, I still don't know so many things, so I have to read so much. That is okay, and I think that's what I enjoy now the most. So it's not just exciting cases I'm seeing all day, and it's not just, well, while patient is getting better, even just slight improvement like platelets go up or just kidney function improves, and you're like, yes, and you feel like the happiest person in the world. Of course, this is what makes you a happy doctor. But also nowadays, I realize what I enjoy the most being a doctor is like feeling like a growing process. So growing as a doctor, because you realize you're not there yet and you will never be able to be there yet where you want to be. So you have to read a lot and you have to just see many, many patients, and the process of growing as a doctor. And I agree again with Nick, like it also a process of growing as a personality. And that's like makes your job interesting, life interesting, and that's how you enjoy being a doctor and being a teacher, like the process of growing. So you should never be on the same like spot, and you have to have new goals and new challenges. I think that's quite exciting, and I think that's the most interesting thing. No matter if you're a radiologist or pathologist or internal medicine specialist, like I think my message will be try to enjoy your job, try to choose a field you know that you will be enjoy, so that it's not like
A
your
burden.
job, it's
Yeah.
not like your profession. You should be so passionate, so that maybe you meet your classmate or somebody and he asks, so what do you do? And when you describe your job, you're like, I should be shining. Oh, I'm just doing this thing, and even talking about your job should like make
Like
you
you are
happy.
right now.
Well, actually, I feel very lucky to be a doctor, and like I feel very blessed. So, but again, it's not like 24/7 me looking like this and feeling happy all the times. Again, as you mentioned, we have ups and downs, and that's okay to have ups and downs. And maybe the patient won't notice and your student won't notice, and you just try to be as strong as possible. But yeah, it happens, and that is okay. Nobody's like 24-hour, like 24/7 happy, or 20 to be a doctor or like happy as a person. Well, there are ups and downs, but still, something happens, interesting case, exciting case, or again, yeah, your patient's kidney function, like transplant patients, like your output increased, like, or something. Nobody thought he would survive, and he survived, and then, oh yes, you feel the luckiest person in the world and happy. So, and this is worse of having like these low moments as well, and just bad moments. So you just don't remember all this bad stuff. And so
Thank you
I
so
think
much
like
for
I think I have never been good at being short, especially when I'm talking about my profession. But
that.
I
There's
just
not
wanted to share, yes, my feeling. So it wasn't just, it was not a lecture. I didn't want to speak like about academic like formally. I just wanted to share emotions to the students who, especially like year 3 and year 4, who are trying to choose a field now, and even like graduating students, um, so that they know how it is. Well, it is this way for me. Maybe some other doctor, and you will have other guest doctors as well, will share different emotions, but this is how it works for me.
Okay. Thank you. Have shared so much with me personally, insight that I will be taking away when I graduate. And today, there was literally a flood of like little hearts whenever you would talk about something that you were really passionate about. And I hope everyone who listened today got something, a little something out of our talk with Nika and Dr. Gvantsa. Thank you so much for being here with me, and I hope to see you soon.
Thank you so much, Leka, for having me, and hopefully, oh, it was somehow helpful while talking about this. Thank you so much, and I want to wish you all the students, graduating ones, and also like even like first year students, to feel like happy doctors and lucky doctors. And just my main message is enjoy what you're doing. Whether you're in research or in pathology or you're a surgeon, just try to enjoy what you're doing.
Thank you so much, and I
Thank you.
will speak to you soon.
Bye-bye.
Bye.
See you soon. Bye-bye.
Oh my God, that was Dr. Gvantsa. She shared so many amazing things with us. She's one of the best instructors we have, just like Taco said. And that is it, guys. Day one, Miss Angel Monday. We spoke about nephrology, we spoke about pathology. I tried to answer some of you guys' questions. So thank you so much to all of you who joined us today. And see you tomorrow, same time.